Hello, and welcome to From the EBPL Archives, Encore presentations from the East Brunswick Public Library. I am your host, Melissa Hosick. This event was presented as part of our Just for the Health of It initiative. Just for the Health of It is a proprietary health literacy program developed by the East Brunswick Public Library to promote health literacy in Middlesex County. To learn more, visit justforthehealthofit.org. Now, enjoy the program.
So welcome and thank you for joining us this afternoon for today's Lunch and Learn with the Doctors on Life After Cancer. My name is Kathy Churton and I am a consumer health librarian at East Brunswick Public Library. Today's program is brought to you by Regional Cancer Care Associates Central Jersey Division, Wellness Nutrition Services LLC, Cancer Support Community Central New Jersey, and the library's Just for the Health of It initiative to promote community health and wellness. Our speakers today are Betsy Dubov, Registered Dietitian, Wellness Nutrition Services LLC, Dr. Ellen Ronnen, Medical Oncologist and Hematologist, Regional Cancer Care Associates Central Jersey, and Katherine Schaible, Program Director of Cancer Support Community Central New Jersey. Please be aware that this talk is being recorded. Please keep your microphones muted and your webcams off. The recording will be available at ebpl.org/YouTube. If you have any questions, please type them into the chat box. Our speakers will answer questions at the end of the talk. The speakers will not be able to offer personal medical advice to attendees during this program. And without further ado, I will turn things over to our first speaker, Dr. Ronnen.
Thank you. Can we advance the slide? Okay. So in the next 45 minutes, we're going to talk to you about life after chemotherapy and also life after cancer care in general. And I liken it to the springboard of survivorship. I'm going to talk to you all about what survivorship is and all the different ways that we should be, and hopefully will be more in the future, helping patients as they navigate their post-cancer world. So you finish chemotherapy, and I've brought so many patients to this point. Where do you go next? And so the first thing, you typically have a routine office visit with your patient, with your provider. And at that visit, it's not the survivorship visit, it's the first visit after chemotherapy. And so we're just trying to make sure that we're going to get you back on track in terms of where your life was before. But we also need to make sure that you know where you've been. So first we ask patients, this is often the time where I'm asking them, who's your primary doctor? You need to go back to them. Maybe you're overdue for a colonoscopy, maybe you need a mammogram, depending on why you were seeing us. And then we do talk about how we're going to need to go over their plan, depending on what kind of cancer you had. Do you need CAT scans annually? Do you need mammograms more frequently? Do you need colonoscopies? Do you need to see a surgeon? Is there more surgeon in your future? But you also need to know who took care of you up to this point and who's going to take care of you in the future. And all of what I just said is going to be reviewed at this survivorship visit. And so I introduced the concept of survivorship to patients. And you could and you should talk about survivorship when you first meet patients, but I found that patients really begin to absorb it when they're done with the chemotherapy in their heads. And survivorship really centers around every aspect of the patient's care. You're trying to do it. So they say it's surveillance, intervention, prevention, coordination. But what that really means is trying to prevent, but also look for recurrences of the current cancer, new cancers, trying to intervene on symptoms patients might have. But I would say one of the most important things that needs to be done when you're starting this journey after chemotherapy is to coordinate with other doctors in the patient's care, because that's the part that sometimes falls off as we become so focused on moving forward with chemotherapy. So let's take a step back, and what happens during chemotherapy? Why do we need to do so much afterwards to repair any damage? So chemotherapy, as you all know, can cause short and long-term side effects. I listed the short and long-term side effects on the left, and on the right, I just wanted to go over in a simple way some common ones and where we should be thinking of getting the patient to as we talk about what's happening to them. So during chemotherapy, patients can have hormonal changes. This is very specific in our breast cancer population, especially. That can cause weight gain. And that's often a springboard to saying you need nutritional support. You should see a dietitian, and we're going to hear more about that. Hot flashes, also very common in the breast cancer population. That in itself needs to be managed, but it can cause mood changes. There are so many other things that can cause mood changes in our patient population, but that's a springboard to you should get mental health support. Fatigue can cause patients to lose some of their function in terms of what they want to do, not necessarily in activities of daily living, like they can still take care of themselves, but they might not be able to play golf and or do the grocery shopping like they want to do. So exercise and physical therapy are often recommended for that. And then surgery, I mentioned before, you can have surgery and it can cause problems. And specific to breast cancer patients, they can have lymphedema, but patients can have other surgical issues. And so that's often an indicator for referring to physical therapy, occupational therapy specialists. So this is a very messy slide, and my only point in putting it up was to show you the spectrum, the wide spectrum of problems that occur related to chemotherapy, or some of them actually relate to every aspect of cancer care. And so in a perfect survivorship world, when you're sitting at the survivorship visit, you're supposed to be asked if you have all of these and assessed for all of them, because all of the issues, the concerns, can be something which would lead to further care and management to trying to get you back to a person that you were, or to get to a better state. So the spectrum consists of cardiac toxicity, anxiety, depression, trauma, distress, cognitive function, which is different from mental health concerns. And I've had patients who after chemotherapy felt their cognitive function wasn't as good. Fatigue, lymphedema, hormone-related symptoms I just mentioned. Pain is a big one. Sexual dysfunction, sexual function, sleep disorders, which could also be related to hormonal therapy changes, hormonal changes. Healthy lifestyle, trying to get that back, and also trying to keep patients up to date with immunization and infections. So during the survivorship visit, there's so much to go over and to make sure that the patient doesn't have a deficit in any one of these areas. So what is the actual survivorship visit? And the survivorship concept should be more than just a visit, but oftentimes it's just one or two visits in our practice. In an ideal world, survivorship is something which would go on and you could have, multiple visits if you chose. The visit can occur during therapy, but most commonly in most centers in the United States, it's occurring after chemotherapy. So when you sit down with them, what's the goal of the visit? And we talked a little bit about assessing for referrals and needs. But the first thing that we're trying to do with patients is to document their disease and their journey. And what I mean by documenting and also their journey is at the end of the visit, the patient should get a written, like a piece of paper they can put somewhere in their home that will document what kind of cancer they had, how big their tumor was, were any nodes involved. If it's a breast tumor, was it estrogen positive? Was it progesterone positive? Was it HER2 positive? And it will also talk about the date of your surgery, the date that you received chemotherapy drugs, how much of chemotherapy drugs you received, what the names were of those chemotherapy drugs, and when you completed chemotherapy. And this was really driven home to me how important this is when I ran into a physician in the community who had been treated many years before by my practice. And the person said to me, you know what would be really great? I have no memory of anything I got. I don't remember the dates, the drugs, anything. And I was like, wow, if a doctor's saying that, we really need to do this. And this is why, not because I thought this, but because this idea, this concept became recognized nationally as a real deficit in our care. And so now we do this. The other important thing about that documentation of disease and the journey is that a copy is supposed to be sent to the patient's primary. so that your primary, when they're going to be taking care of you, will not say, oh, I know you got this, you got this, you got this. What else is on that form? On the survivorship document, you're also supposed to have the listing of who took care of you. Did you see a surgeon, a radiation oncologist, obviously the medical oncologists, the phone numbers for each. And then also there's supposed to be a section which talks about follow-up. Do you need a mammogram every 6 months for the first 2 years? Do you need a colonoscopy in a year? Do you need a CAT scan in 6 months? So that document has all of that on it, and it would actually go to the primary, and it should go to the patient. So managing side effects, I just spoke about before, but that's also very important in the survivorship visit. How's the patient feeling now? And then this segues into which referrals should I be sending them for, and where should I send them? And then the last part of the survivorship visit, which sometimes isn't done, and I think because it's an uncomfortable conversation for everyone involved, is the purpose and importance of healthcare directives. And so I'll go over that briefly at the end of this. So what about cancer survivors makes them perfect candidates for rehabilitation? So the numbers of survivors is increasing with our aging population, and also our better therapies. So more patients are just living having had cancer. But 2/3 of our survivors will be over 65. And many of those patients come to us already having multiple comorbidities, which is another word for other medical issues. So they're already deconditioned, debilitated. And physical therapy can improve their baseline dysfunction, which they might have because of their comorbidities. And as we'll discuss, many adverse consequences of chemotherapy or cancer treatment can be effectively treated with interventions from rehabilitation. So why should a cancer patient who's completed chemotherapy or during it be referred for physical therapy? And physical therapy has expanded so much in recent years, and it's not what many of us picture. But physical therapy is commonly known to improve fatigue. It also can improve cardiopulmonary function, and it can actually help decrease pain. So usually we refer patients after chemotherapy is completed or towards the end. And there's increasing data, however, that prehab or starting the therapy even before they get their chemotherapy or during will improve a patient's outcome. And this is partially because you can catch them before they fall, and you can actually bring them to a higher baseline. And so this is important to know, for us, but also in the future for everyone to know, because if anyone needs further therapy in the future, we should always try to optimize their status in the beginning, because it's going to make their tolerance better. They'll be able to tolerate more therapy or more standard doses or different drugs. If a patient comes to me and looks very debilitated, I'll often not want to consider the better, more aggressive therapy. Physical therapy can also improve symptoms related to less commonly talked about problems. And this is what I was referring to. It's more than just what we all used to remember. So sexual dysfunction, it can actually work on lymphedema symptoms, which is the swelling of the arm after breast surgery. Surgical pain, specifically if patients have had amputations and neck dissection, there are specific techniques the physical therapist can use. And neuropathy is actually becoming an increasingly common reason we refer for physical therapy. So exercise post chemotherapy, I'm just going to touch upon this briefly, but so this is not an organized program necessarily. This is a patient going out for exercise. And the American Cancer Society does recommend 150 minutes of exercise per week for cancer survivors. They don't mean necessarily rigorous, very heavy duty, so to speak, exercise. They mean moderate. And the benefits of exercise, as you all know, it can improve your mood, help restore sleep patterns, help with weight reduction. But there is data from multiple studies that exercise will reduce the likelihood of recurring from a cancer. And this is across multiple disease types. And also there's benefits for neuropathy. Just keep in mind, exercise should be individualized to each patient based on any ongoing symptoms and also what their doctors are telling them. So the last thing I wanted to say about rehabilitation, and this is particularly noteworthy during the pandemic, is that there, as we all changed when the pandemic began, so did the physical therapy organizations. And there now is a robust program for telerehabilitation. And there are ways they can help patients. Obviously, it'll go across different cancer types. And patients have reported it is beneficial to them. It's an effective way to get rehabilitation. And the spectrum of symptoms they can help with telerehab is wide. And you can see some of them listed there, but it doesn't have to stop because of the pandemic. And then the last thing I wanted to touch upon was the advanced care directives. An advanced care directive is a document to make healthcare preferences known. You can actually fill it out at any time in your life or during a course of disease. There is a desire to, many patients have desired to fill it out at the beginning of their cancer journey because they feel like they're at the peak of their cognitive strength. They know what they want, they know what their wishes are, and they want to make sure everyone involved in their care knows it. And so sometimes it can empower patients to become involved in making these decisions. And it doesn't, when you fill out an advanced directive, it doesn't mean that you have necessarily an end stage disease. It just means you want patients to know how, not patients, you'd want your family and people to know how you'd want to be cared for in the future. And then that some types of advanced directives are a living will or a power of attorney. The power of attorney is basically saying, if I couldn't make a decision for myself, who would I want to make that decision? And so a lot of people find comfort in beginning to think about these things and getting them taken care of before they embark upon any treatment. So, so that's a little bit about survivorship and specifically more in physical therapy. I'm now going to hand it over to Betsy Dubov.
Hi, everybody. It's so nice to be here. My name is Betsy Dubov, and I'm a registered dietitian in private practice in the East Brunswick area. So today we'll be talking about nutrition and how it can help you feel better, look better, and have a more healthy response to the treatment that you had. So good nutrition is really a very important part of your health beyond the cancer. It can help with recovery and healing, help you regain strength and weight if you lost weight during your treatment. It can help you manage ongoing side effects, reduce future cancer recurrence, and it is very, very important to maintain a healthy weight, and I'll explain that further on. The picture in the middle illustrates the way we're teaching people to eat in a healthy way. We're suggesting that they just take a standard size plate and immediately divide the plate in half, putting fruits and vegetables on one side. A quarter of the plate would go for protein foods, and plant protein is highly emphasized in terms of prevention of cancer and preventing recurrence. A quarter of the plate would then be for whole grain foods and starches, preferably whole wheat, foods that are not processed, that are in their most natural state. Next slide, please. Okay. The American Institute for Cancer Research is a wonderful organization that provides a lot of educational information to people who are interested in cancer prevention, treatment, post-cancer. They have an extremely large amount of information that's available for free. The first website, and this will be made available to you after the talk, is just general information about cancer survival. It encompasses all the things we'll be talking about today. And the second address is for specific recipes where you can incorporate some of the recommended foods that we'll talk about later. Okay, next slide, please. These are some goals. The next two slides are going to be talking about some goals to change your behavior or to maybe incorporate behaviors that you did before treatment. Keeping your weight within a healthy range with a body mass index between 18.5 and 24 is really the cutoff is recommended. And if you'll excuse me, I don't have a whole lot of information on my slides, so I'll be turning pages as we speak. Too much body weight and body fat can create a more cancer-friendly environment. So getting down to your ideal body weight is helpful. It's also helpful to be physically active in your everyday life. Dr. Ronnen talked about that, rehab and helping you become stronger. But even simple exercises like gardening, walking, yoga, or even housework can help you feel stronger and achieve your goals in that regard. Eating a diet rich in whole grains, vegetables, fruit, and beans are a healthy way to go. We'll be talking about some of the substances in foods besides vitamins and minerals. They're called phytonutrients. And these types of eating these types of foods will expose you to the most phytonutrients. Now, in terms of drinking, it's recommended, especially if you don't want to gain weight, to try to drink fluids that do not have caloric value. It even goes on to talk about fruit juice, because if you eat the whole piece of fruit, you are getting all the phytonutrients and fiber and healthy ingredients in that particular fruit or vegetable. So try not to drink your calories. Next slide, please. Okay, these are some general guidelines of what would be best for you in terms of your food choices. Limiting high-fat foods is a definite benefit. High-fat dairy, especially. Try to use reduced-fat dairy products, skim milk, reduced-fat or fat-free yogurt. And you can also use other forms of milk that have been fortified with calcium, like almond milk, soy milk, oat milk, and nut milk. Those are very popular now. Their fat content is very low. Very important for everybody, and these are really important for everybody. Limit dietary and saturated fats. Try to use mono or polyunsaturated fats with cooking and at the table. This would include oils like canola or olive, using nut butters, nut butters that have nothing in them except for the ground nuts, as opposed to sugar and added fats and things like that. Olive oil spread is a good choice. The next would be to limit red and processed meats. Avoid meats like ham, sausage, bacon, salami, and hot dogs. It's also recommended that you limit your intake of red meat to once a week or less. Alcohol. It's generally recommended that people who have had cancer stop drinking. But if you decide that you do want to have a drink, remember 1 drink a day for women and 2 drinks a day for men, maximum. I will be talking a little bit more about supplements for cancer prevention, but as I mentioned about the juice, if you just are taking individual supplements to get nutrients that you think you need, you're losing the phytonutrients and the combination of them in foods that are not present if you just take a pill. So keep in mind that a healthy diet rich in colorful fruits, vegetables, grains, beans, and lean protein is the way to go. I know I'm harping on that, but it's very, very important. Next slide, please. Okay, if you think you're unable to meet your nutritional needs with your diet alone, if you're losing weight chronically, if your appetite is very poor, it's very important that you talk with your healthcare team before taking any vitamin supplements or even liquid nutritional supplements. Just check in and find out what would be best. We generally recommend trying to get your nutrients through food if possible. Now, the next point in this slide is to talk about eating problems that can be caused by cancer treatment. They're not all listed here, but I do want to address them. A lot of people find that they have changes in taste and smell, and foods that they enjoyed before they had the treatment are not palatable to them. So at this point, I want you to feel free to try other foods. A lot of people complain that they eat meat and it just doesn't taste, red meat, or it doesn't taste good. But I want you to keep an open mind about other forms of protein. Try fish, try chicken without the skin, try some plant protein foods. Don't hesitate to fool around, and possibly you will get your taste back for the foods you enjoyed. A lot of people also experience bland taste, where the taste buds don't seem to work as well. So if you don't have mouth sores, which we'll talk about next, try adding stronger flavors to your food with spices, seasonings, even pickles, dressings, and citrus flavor. This can enhance the taste of food and help you eat better. Some people also have mouth sores. So it's important to stay away from acidic or spicy foods and avoid sharp and crunchy foods that can irritate the sores and maybe cause them not to heal as quickly. So you want to stay away from chips, pretzels, crackers, foods that are crunchy and not soft that can irritate your gums and the mucosa in your mouth. Try to have, stay away from acidic and as I mentioned, spicy foods. Avoid drinking alcohol, especially if you're having the mouth sores, and don't use alcohol-based mouthwash. Some people are very bothered by the smell of food, especially while it's being cooked. So I recommend just staying elsewhere in the house, besides the kitchen, maybe not even wanting to eat in the kitchen, but wanting to eat somewhere where you're not smelling the food as it is cooking. Also, foods that are served at room temperature or even cold are tolerated better than hot food, which has a stronger smell to it. You can light a pleasant scented candle around your meal, or open up a window or put a fan on to reduce that issue. Some people also experience a metallic or bitter taste in their mouth. And in that case, I recommend staying away from normal silverware and using plastic utensils. You won't encourage that bitter taste. And also don't cook with iron pans. If particular foods taste metallic, just try to stay away from them and eat others. Some side effects are normal and many will pass with time. Next slide, please. Okay, let's talk about some issues, some issues that you possibly can have after treatment, because treatment is very rigorous in most cases and your body does need time to heal. A lot of people will complain about feeling fatigue, and I want to emphasize, and I think our social worker is going to talk more about these issues, but it's very important to ask for help. Try to enlist your family members and your close friends to help you cook, assist you with other daily tasks. Try to take on less and cut back on your responsibilities so that you can rest when you want to. Take advantage of the days that you feel good. Take advantage of the days that you feel good and try to accomplish what you can without overdoing it on those days. Organize your activities around the times of day that you feel the most energetic, and try to do things you enjoy at those times. If you're feeling well, it's a good time to feel like you could cook in bulk and prepare foods like soups and stews that you can have on, as available to you, and you can also freeze for times when you might be rushed or not feeling as well. A lot of people also experience a poor appetite or weight loss. We'll address those together. Some helpful ideas: set an alarm to remind yourself to eat every 2 to 3 hours and try to eat small, frequent meals. It's also helpful to eat with family and friends so that the atmosphere is pleasant when you're eating. Set the table nicely with a pretty plate, a placemat, possibly even having flowers on the table or an attractive centerpiece. It's also recommended that you do not drink fluids while you're eating, as this may help you fill up faster and cause you to eat less food. So try to drink fluids in between meals. A lot of people experience weight gain as well. Some of the chemotherapeutic drugs can cause weight gain, and some people start out being quite overweight before their treatment. So getting down to, as I mentioned, a lower weight, a more healthy weight is helpful, but some things you can do post-treatment would be avoid empty calorie foods, snack foods that really don't have too much nutritional value, avoid higher calorie foods like rich sauces, cream sauces, excess use of oils and fried foods. Flavor your foods with broth and herbs and low-calorie marinade and fruits. As I mentioned about exercise, if you're fit and your doctor has given you the green light, find light activity that you enjoy. And it's sometimes more helpful if you enlist a friend to exercise with you or to keep you company. Now, this brings me back to the plate method, which I showed you the plate, how it's divided. Half of it is filled with healthy fruits and vegetables. A quarter of the plate is lean protein. Keep in mind for portion size, you can estimate the amount of protein that you need by using just your palm and the thickness of the bottom of your pinky finger. You only need 2 palms a day to get all the protein that you need. So you can divide that up through your meals however you want, but you don't need that much animal protein or protein to get through the day. Okay, the next slide, please. Okay, this is just an example of a food record. There are many different forms of records available for free. This one actually has your food and drink, this amount you've eaten, and any symptoms you might feel regarding your cancer or even anxiety or issues with the way food tastes. You can write them down here. It's also a good idea to include the timing of your meals and snacks. And you could also rate your symptoms as from mild to severe. This is very helpful for you if you're trying to lose weight, because you can get a better handle and see in black and white what you've been eating, also for weight gain purposes, and also for your healthcare providers to get a sense of what you're taking in on a daily basis. Next slide, please. Okay, it's not so easy to read, but this is a slide talking about how our diets should be rainbow. Okay, every pigment in certain fruits and vegetables has benefits, and these are groups of foods that have similar nutrition value as well. So let's talk about cherries, tomatoes, watermelon. The middle column talks about the different phytonutrients that are in these foods, and some of them help your immune system become stronger. Some of them prevent inflammation, which is an action in your body that is thought to possibly be related to some cancers. Others decrease your risk of heart disease and also certain cancers. So look down the list, and that's why it's important to have such a wide variety. This slide was on a website, so if you could click onto these bolded items, you could get the recipes for them, but you can go onto the American Institute for Cancer Research website and find many of these resources. So thank you very much. I hope this helps, and we'll have some time later for some questions. Thank you.
Okay, thank you very much, Dr. Ronnen and Betsy. My name is Katherine Schaible. I'm a licensed social worker by discipline and the program director with Cancer Support Community, Central New Jersey. We're going to just take a couple moments to talk now about mental health and emotional well-being beyond cancer and what that means for you as cancer survivors. So life after cancer looks different for each and every one of you who has gone through it. Whenever, whether you've either just recently completed treatment or if you've just wrapped up care after a recurrent diagnosis, you understandably are thinking about rebuilding your life and getting back to what makes you happy. So we're going to learn a little bit about the common feelings that most cancer survivors experience once they've completed treatment, and recognize the need for emotional support and where to turn to when you need it the most. I find it interesting when I speak with most cancer patients or people with cancer, because you begin to identify and define yourself differently depending on what survivorship means to you. So I encourage you to just sort of ask that question to yourselves and maybe jot down some thoughts. But things that I've heard are concepts ranging from the fact that, cancer doesn't define me, right? And with that, the notion of surviving means that cancer might be bigger than me, so I prefer thriving over surviving. Other opinions may, many times I would say, folks feel a lot of pride around overcoming the battle and that you have not surrendered, and therefore standing out as a beacon of hope or support for others who or you hope to also survive. In survivorship, I think what resonates most for me is that we're seeing and we're empowering folks to really live well in the face of cancer. I just wanted to acknowledge the fact that, this is a very unique identity to each individual as we talk about mental health in the face of cancer. Next slide, please. So a cancer survivor, by definition, according to the National Coalition for Cancer Survivorship, is anyone who has been diagnosed with cancer from the time of diagnosis through the rest of his or her life. And I want to just highlight the last portion of that definition for a moment, through the rest of your life, because the fact of the matter is that more and more people are being diagnosed with cancer today. And with that, more and more people are living longer lives with cancer. And because of the advances in treatment, as Dr. Ronnen touched on a little bit, there are folks who are living beyond cancer, that they have moved into this phase of post-treatment survivorship. And so with the estimated number of 14 million cancer survivors living in the United States today, for the purpose of this conversation, we're going to just focus on people who have specifically completed treatment. So it's important to realize that a cancer diagnosis and the course of treatment changes your life in at least some way, no matter what the outcome is. And so with that, it's helpful to build a post-treatment routine that incorporates self-care and gratitude and wellness to assist in your ability to move forward. So of course, Dr. Ronnen and Betsy have already discussed a lot of the physical components of survivorship. The elements of survivorship are complex because it really encompasses the body, the mind, right? Your spiritual aspects, everything, the whole person. So, but you're also in a position where you have a lot on your plate that you've never had to deal with before. In wanting to regain some sense of normalcy, you're likely getting back to work or back to other activities or things that you used to enjoy before. And you're on the phone with insurance reps and, burdened with the financial concerns that you never really had to think about until now. So with all these practical issues, there is a psychological impact. So with your emotions and stress and worry on your plate as well, we need to really prioritize your mental health as an aspect of your overall health and survivorship plan. Next slide, please. So distress is probably the most misunderstood and underreported side effect of cancer. In fact, it's the most common. And so when thinking about the complexities of survivorship or just the complexities of being human, distress can really range, it has a vast range of symptoms or feelings that one might experience, from vulnerability, exposure, sadness, irritability, all of those types of things, all the way up to something that's a more severe depression or an anxiety disorder that would be clinically diagnosed with a mental health practitioner. The thing is here that no matter the degree to which you're experiencing distress, research suggests that if it goes unaddressed, it will have a negative impact on your quality of life. However, the good news is that distress is very, very manageable. And 9 times out of 10, you, as just a human being, have the tools and resources in your back pocket to lean on, and it's our job to ensure that those things are activated to help you. Okay, next slide, please. Distress manifests itself really through physical reactions. So if you find yourself crying and crying often, that's something to be paying attention to. Or that relentless feeling of exhaustion or feeling under the weather, or perhaps your body is telling you something if you're feeling overly tense or shaky through your nerves. These are all visceral reactions to the distress or underlying emotions that you may be experiencing. Other ways that this may play out, perhaps in your social realms, is through, withdrawing from people or activities or anything that reminds you of the cancer, a level of avoidance that really isn't too healthy. Or the opposite effect of that is almost over-engaging or seeking out reassurance with everyone who you speak to that you're going to be okay. Next slide. But so different from the signs of distress, there are, but similar, right? There are common emotions or experiences that people face after cancer. Understandably, you are feeling a sense of relief that the cancer's over. You've been given good news. But there's a notion to proceeding staying cautiously optimistic. And the reason that is likely because you're protecting yourself from the expectations that other people in your life may be placing on you, or perhaps you place on yourself, and from that fear of recurrence, which we are going to get into a little bit later. But other common emotions that individuals face, your body has been through a lot. And with those changes and new limitations, there's a level of frustration or sense of grief that you are reconciling, similar to when you lose somebody in your life or something that's important, or a sense of letdown or confusion, right? I've been through this thing, now what? Where do I begin next? These are all just very common experiences that many people talk about when they've completed treatment. But I want to get into the fear of recurrence. Next slide, please. The fear of recurrence is very real. It's a very, very common concern for survivors. And in fact, it's one of the most insidious emotions that I think impact you the most, because it finds its way to interfere with every aspect of your life, from eating to sleeping and working and playing. This fear can really be triggered by just daily reminders in your way of life, right? If you're going to your follow-up visits, like these well checks that we were talking about are so important in your survivorship plan, but those follow-up visits entail scans, and you're anticipating what's coming back on the scan. That can really trigger a lot of what you've already been through and your fear of the cancer returning. Perhaps there's birthdays or anniversaries or different occurrences, like if someone in your life or someone you know has been diagnosed with cancer. That puts you emotionally back into the shoes that you've already worn. So part of this is really about learning ways in which you can cope with the fear of recurrence, or cope with really any primary or main emotion that is sort of forefront and in your way. So first and foremost, 110%, I believe that it's important that you remain informed by the reputable resources that you have on hand, and that you do your best to remain as present-minded as reasonably possible. And through the process of talking about your feelings with your doctor and with other trusted resources that you have, you can become actively involved in your survivorship plan. And And so the expectation is that the more in control you are, the more that you can sort of manage the evident or the inevitable ebb and flow of this type of fear. It's really important that you allow yourself to just feel upset or feel what it is that you feel. Some advice that I like to give to any patients that I work with is, you know what? Everyone is entitled to your pity party. But what that means is that you go to the party, and when it's over, you wrap it up and you put it back on the shelf. And so the notion of being able to take that off the shelf and put it back up again teaches your emotional intelligence that it's okay to sit with things in order to make them go away. Because really there are positive effects to expressing negative emotions, especially the fear and the anger and sadness and things that that occur on any given basis. So pay attention to your feelings linked to any type of avoiding behavior, especially if it means that you're avoiding your medical treatment. We want to make sure that you're aware of what's getting in your way. Next slide, please. So speaking of avoidance, avoidance really is rooted in, the denial that a problem exists, and withdrawing from your social interactions and avoiding the problem by masking it with maladaptive behaviors that we often are using as a negative distraction from the reality. Actively coping, however, looks like the ability to accept the problem that exists. And that's easier said than done, although you can reach a level of acceptance through taking action to get rid of the problem. So like I said, talking with your medical team, looking for advice and information in a place where it will be supportive, and slowly sort of adopting a new perspective so that you can make the best out of a bad situation. Through becoming aware of your feelings, you will then in turn know how to express them, or at least get your point across to others who are there to likely trying to support you on the other end. Next slide, please. So certainly after cancer, many people realize that there are things more important than cancer in their lives. This is where you begin to kind of mold and shape a new sense of meaning and hope in your life. And think about opportunities, perhaps, that cancer has provided you. So one thing that I often hear about when we're talking about this in support groups that I facilitate is that, there is this expectation that people in your life are going to be there for you and support you through this difficult time. And through the disappointment, perhaps, that those who you expected to be there the most weren't, there are other people who cross your path or who come into your life who you never expected to show up and arise to the occasion. So there's these little ways of looking at the situation and understanding that on the other side of it, the emotional highs and lows are to be expected. And there really could be some level of a silver lining. Next slide, please. So life after treatment really is all about developing, defining a new normal for yourself. Exploring ways to enrich your emotional health and peace of mind, whether it's seeing a therapist or going to a support group or repeating comfort words or affirmations to yourself, or doing the wellness exercises like meditation and breathing techniques. It's natural to experience depression over what you've lost, or to feel anxious about the fact that your cancer might come back. So it's important to make a plan to resolve those issues as they emerge. So you have to live for yourself. While it's important to keep an eye on your health and wellness, you do not have to make your entire life about cancer. So when you feel up to it, you can do things like travel and taking some chances and indulging in your life and enjoy it as much as possible. And most importantly, I think it's crucial that you connect with others who understand your experience. Beyond family and friends who are doing the best that they can to be there for you, there are, as I mentioned, a number of cancer survivors out there with similar experiences. So whether it's tapping into, there's a myriad of blogs and online platforms and seminars like this with like-minded people, or support groups at organizations like the one that I work at Cancer Support Community, that can help you. Next slide, please. It's important to remember that recovery takes time, that when treatment ends, you're often not prepared for the fact that recovery does take time, and that in general, recovery will take much longer than the treatment actually did. The healing continues beyond that. So people will often say that they didn't realize how much time that they needed to recover. If you need any support or connection or find the need to continue the conversation, please remember to reach out for support, and we're here for you.
Okay, so thank you. And right now we'll open up to Q&A. So if you have any questions, please type them into the chat box. And as a reminder, our speakers are unable to offer personal medical advice to attendees during this program.
While we're waiting for questions, I just want to say I'm so grateful that both of you were interested in doing this collaboration, because I think it was amazing, and I learned a lot from both of you. So thank you so much.
Thank you.
Thank you. It's a pleasure.
Absolutely. Thank you both.
Okay, so I don't see any questions. So I just want to say thank you, Dr. Ronnen, Ms. Dubov, and Ms. Schaible for taking the time to present on this topic and to answer our questions. And so thank you everyone for joining us for today's talk, and take care and stay safe.
Take care.
Thank you, everyone. Take care.
Thank you.
Thank you for joining us for this week's Encore presentation. To join us for live programs or to learn more about the East Brunswick Public Library, visit our website at ebpl.org.